Good morning, everyone. I'm pleased to be here in Sapporo to present a paper that hopefully you'll find interesting, but even if you don't, it wins the award for the longest title. Okay, how do I advance this thing? So the objective of the study was to assess the efficacy of a commercially available product called Whisper in predicting relapse and mortality risk in cattle treated for bovine respiratory disease. The Whisper technology is essentially an electronic stethoscope. It's a non-invasive tool for assessing lung health, and it potentially allows for the early and accurate detection of BRD, and this is very useful for disease management purposes. For those that have worked in BRD and in feedlots, we have a limited number of tools to assess disease. We use visual means and body temperature as our two principal ways of determining whether an animal is sick and whether therapy is going to occur. The other interesting thing about Whisper, it doesn't require the user to be an expert in diagnosing lung sounds. It's a proprietary technology using electronic stethoscope and has an analytical algorithm software built into it in order to determine the degree of lung pathology in the animal. So the device is hooked up to the animal, and then an objective score of 1 to 5 is assigned. 1 is being identified as an animal is essentially normal, and then progressing on to mild acute, moderate, acute, severe, and then chronic. So you can see, and I won't read them out to you, but it's a progression of lung pathology from 1 to 5, and it's scored in the algorithm. So in our study, it's a prospective cohort study, and our population was feedlot animals diagnosed with BRD, and it's a population of calf-fed Holstein steers, N is equal to 2,023, and then beef breed steers and heifers, and the N there is equal to 703. So it's a significant size study. The Whisper score was collected at the time of first treatment for BRD, and a standard therapy was applied to all of the animals once they were assigned a score. And then we followed the animals for 120 days after enrollment. So to get on the study, the case definition was the animals were sick based on subjective criteria that would be pretty standard for feedlots in North America. General appearance of the animal, its attitude, gauntness, reluctant to move, and a degree of depression. These animals are taken from the home pen and then moved to the hospital facility. And at that point in time, a diagnosis of UF or undifferentiated fever is if the animal has a rectal temperature above 40.5 degrees Celsius, and then no previous treatment in the treatment history of the animal. And an animal that as an initial no fever, its rectal temperature was less than equal to 40.5 degrees. So in this study, the animal is the experimental unit. General linear mixed models, the outcomes were BRD retreatment and BRD case fatality rate. And the level of significance here was, for statistical significance, 0.05. So if we look at the results and look at the distribution of the animal count by Whisper score, You can see that there's a 1 and 5 are, not surprisingly, the lowest categories, 2, 3, 4, and 5. There's most of the animals have a score of 3 in the data summary. So if we look at the results and BRD retreatment rate, you can see that generally the retreatment rate increases as the whisper score increases, which is what we would expect. And you can see with the subscripts there which of the differences are statistically significant. And similarly on the BRD mortality, here you get a sharply increasing BRD mortality rate as the whisper score increases. So in conclusion, the whisper score collected at the time of first BRD treatment significantly associated a risk of BRD relapse and BRD mortality. And the risk of BRD and relapse were observed to numerically increase as the whisper score increased from 1 to 5. Now, not all of those differences are significant because even though there's a large number of animals in the study, with variation, you would need even more animals. But I'd be fairly certain that those linear trends that are observed would be significant, statistically significant, if there were a larger number of animals in the study. So, as was discussed earlier in the keynote address, there is advances in bovine internal medicine over time, and this tool would give clinicians a means of assessing in the live animal the relative degree of lung pathology present. And it's I think quite an interesting technological development from an internal medicine point of view, and the application of this tool in larger scale production settings would depend on the individual circumstances, the time and costs associated with acquiring the image, and whether or not you could indeed change the course of therapy basis the whisper scores, and whether you could affect outcome enough to make it a cost-effective solution on a large-scale basis. All of those things, we have studies that we're looking at to answer some of those questions, but I believe that the basic science question and the data to support and validate this tool is present here in this study. Thank you for your attention, and if there's any questions, I believe we may have time to answer one or two. Thank you very much.
Thank you.